headaches, especially one-sided headache, nausea, vomiting, tiredness, stomach ache, abdominal pain. All these are signs of high level of bile, known as biliousness. Today I'm going to be talking to you about headaches, bilious headache. This is headache that is as a result of high level of bile in the body. Oftentimes I have people come to me and they tell me, oh, I'm having ulcer. And from investigation, I've found out that actually a lot of the stomach ulcer is actually not ulcer because the symptoms are similar. But today I'm talking to you about bilious headache. That is headache as a result of a disturbance in the liver. Of course, you know what your liver is. I'm not really going to go divulge into so much details about the liver, but the liver is an internal organ. It's the largest organ and is responsible for a whole lot of function. Now, the liver, one of the functions of the liver is production of bile. If for any reason there is a problem with the gallbladder, the biles are stored in the gallbladder. If for any reason there is an high level or overproduction or there's a problem with the bile, but the gallbladder, you have excess bile in the body. Now, the classical sign of this liver problem is headaches. I tell you, headache. So how would you know normal headache from headache that is from the problem in the liver? The symptoms are classically resemblance of malaria. You have joint pain, you have tiredness, you have this headache that is one-sided, headache with vomiting. In fact, that is a classical sign. Headache that is relieved by vomiting, and when you vomit, you pass out, like greenish or yellowish substances. That is headache that is as a result of a problem of the liver. What should you do when you have this symptom? I advise you, don't start with drinking drugs. First of all, go see, you can book to do a consultation with us, or you can go, see a doctor. But the thing that you need to do, just in case you don't have access to that, you need to go and run a blood test. The blood test that you need to run is your liver function test. I tell you, once you run that test, it will show. You have very high level of bilirubin. It will show in your blood works that you have this. Another thing that can be done is an abdominal scan. You see, it's important that you don't just assume. A lot of times, I decided to do this video because I'm beginning to see recurring incidences of liver problems because they were not early diagnosed. These persons were having these symptoms and they went on treating malaria, treating something else, using more drugs, and the problem persisted until we have irreversible damage of the liver. So what should you do? I already told you, if you experience these things, in fact, stomach pain, worse after food, worse before food, these stomach cramps, it could just be that the problem is from the liver. So what are you going to do? Remember the classical thing that I've said to you. The thing that you need to do immediately is you need to go and see a doctor. You need to do laboratory tests. So in the meantime, suppose you are experiencing this, what should you do? You should drink warm liquid. Drinking warm liquid is one sure way to help calm the system. That is not going to cure you, but that's going to calm the system. And if you have been diagnosed with this and you are on treatment, there are certain things that you can add. I'm going to give you some short home remedies that you can do to help your liver cells. One thing that you should try and get is blueberries. Blueberries are very good for the liver. Get blueberries, get bilberries, get carrots. Now, I would advise you, don't make a carrot juice. Get the carrot, grate the carrot, and then chew them. You understand what I'm saying? Another thing that will be helpful for you is pawpaw. Pawpaw will be good. Walnuts. I think we're in the rainy season now. You can get walnuts. Plums, black plums, lemongrass. So this is what I'm going to leave you with today. I'm going to leave you with a lemongrass tea therapy. You don't do it more than 1 week, right? So you get your lemongrass. Okay, so I don't have a demonstration here with me. Sorry about that. So you get your lemongrass. It grows in people's compound. Get the lemongrass. Take like 1 leaf of it, chop, and then put it in your teacup. Add boiling hot water in it. Drink it first thing in the morning, drink it last thing at night. This helps with the symptoms and also help with the bile production and also help with the gallbladder. So I hope I've been with this video able to tell you that not all the symptoms of stomach is actually ulcer. It could actually be your liver. And also too, I want you to know that bilious headache is very common. Headaches, let me give you the signs again. These headaches are accompanied by nausea and vomiting. Vomiting of yellowish or greenish substances known as bile. And it's usually relieved by vomiting. Headaches that are relieved by once you vomit, you feel better. That headache is a bilious headache and it's from the liver. Unless you treat the liver, that headache will not go. And I want you to know that headache itself is not a disease. It's a sign, it's an indication that there's something that you need to pay attention to. So till next time, take care of yourself. I'll see you. Remember to subscribe and tell others about our channel. My name is Dr. Rita. See you next time. Bye.